Septic arthritis, or infection inside a joint like the knee or the shoulder, it's a devastating complication of a traumatic injury or surgery. In this video, I explain what septic arthritis is, how it can happen, and what long-term issues can arise from septic arthritis. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service, so you can get the compensation that you deserve. Now, septic arthritis is joint inflammation. It's secondary to some kind of infection, usually bacterial, but it can occasionally be caused by a fungus or viral pathogens or infectious agents. Septic arthritis is usually monoarticular, meaning it involves one large joint, like the hip or the knee. It's an orthopedic emergency. It has to be dealt with right away because it can cause significant long-term joint damage and lead to significant morbidity and mortality. Early diagnosis and early treatment are crucial for preserving function of that joint, the hip, the knee, the shoulder, whatever joint it is. Now, the most common infectious organism in adults, at least, is Staph aureus or Staphylococcus aureus, for those of you that want the full technical name of that bacteria. There's others, strep pneumonia, that's a less common one, but still a significant source of infection in adults. And again, there's a number of others. Risk factors for septic arthritis in adults, and this has been shown in a number of studies, are things like being older than 80 years old, having diabetes mellitus, that's a significant increased risk factor, having rheumatoid arthritis, a recent joint surgery, that's where, as an orthopedic surgeon, we see that a lot, having a joint prosthesis like an artificial knee, an artificial hip, a prior infection inside a joint, skin infections, and skin ulcers, HIV, osteoarthritis, and some types of sexual activity, especially gonococcal or gonorrhea septic arthritis, can be other causes. Again, in my world, orthopedic surgery, it's a prior injury to a joint, especially with an open fracture or something that where bacteria can get into a joint, or a prior joint surgery, and then that joint is seeded by an infection in other parts of the body. Septic arthritis usually presents with an acute onset of joint pain in that one joint. Fever, warmth of that joint, swelling of that joint, and pain, or even making it very hard to move that joint. You don't always have a systemic body fever, meaning elevated temperature. You see that about half the time. With the lower body joints, the hips, the knees, the ankles, those are most often affected with septic arthritis, and the knee is the most common joint in adults, at least, involved in septic arthritis. Like I said, this requires urgent treatment. So treatment of septic arthritis involves both antibiotics and washing out that joint, what we call an incision and drainage, incision and debridement, that type of thing. It typically requires IV antibiotics, both when you start or when you notice it immediately, after you do the surgery, and then for a long time after. Sometimes you have to tailor the antibiotics to cultures that are obtained at the time of surgery. Now, why I'm doing this video is really more to talk about the long-term complications of a septic arthritis. You can get lucky, recognized early, go in, wash it out, treat it with antibiotics, no long-term consequences. But I've seen this with a number of the military veterans I've worked with. You can have long-term issues with it, like a long-term osteoarthritis, osteomyelitis, which is an infection in the bone around that joint, and osteonecrosis, where some of that bone dies, or avascular necrosis is another term for that, and then just long-term chronic pain. Now, if you have ideas for future videos for this Veteran Nexus Letter channels, whether that's an injury or a condition like septic arthritis, risk factors for those injuries, or specifics about Nexus letters, DBQs, or anything else, leave those in the comments below this video. Make sure to subscribe to my channel, click the bell to be notified when I release a new video. And if you yourself are interested in a Nexus letter for your injury or condition, click the link in the description below this video, and then you can learn more about working with me and working with my team. We try to make the process simple. We try to make it as quick as we can for you, and I try as hard as I can to write a Nexus letter that gives you the best chance of success in your claim. Thanks for watching, and I look forward to helping you.